Hello everyone, I'm Dr. Deng from Chongqing Haifu Hospital. Today I'd like to share with you the case of a patient with multiple uterine fibroids. She comes from Inner Mongolia, the land of grasslands in our country. Just hearing Inner Mongolia brings to mind vast open grasslands, a place many of us long to visit. During her local examinations, many fibroids were discovered. The local doctors recommended a hysterectomy. Even though she is 52 years old, she was reluctant to have her uterus removed and wished to preserve it. So she spent a long time searching online for information and eventually chose to come to our hospital for focused ultrasound treatment. During her preoperative MRI scan, we found a very large subserosal fibroid on the anterior wall, about 7 cm in size. Other areas also showed multiple fibroids. Here there are some, and here in the submucosal area as well. There's a small one on the anterior wall, and another on the lateral wall. Overall, the number of fibroids is quite high. We always perform contrast-enhanced MRI before surgery to assess the blood supply to the fibroids, which helps us plan the treatment strategy effectively. Looking at the enhancement, the blood supply isn't overly rich, but the number of fibroids is significant. This type of case is suitable for focused ultrasound treatment. As for the deeper fibroids, they might be blocked by the larger anterior one, making them invisible and untreatable. However, since this patient traveled all the way from distant Inner Mongolia, I was determined to try my best to provide effective treatment for her. Now, let's look at her post-operative MRI. We can see the fibroid on the posterior wall, the smaller submucosal fibroid, another on the posterior wall, and the large subserosal fibroid on the anterior wall. All the visible fibroids have been successfully ablated. In a case like this, at 52 years old, with the fibroids well ablated, the likelihood of recurrence or new growth is very low. Thus, she avoided undergoing a hysterectomy and successfully preserved her uterus. Now, she can continue to ride freely across the Hulunbuy grasslands. That's all for today's sharing. Thank you for watching.